Hey, everybody. Dr. Colin Bartoe here with the Functional Neurology Chiropractic Center. And in today's Concussion Thoughts with Dr. Bartoe, we're going to talk about the symptoms of a concussion. Now, before we talk about what symptoms can actually happen, let's set a little bit of a groundwork and understand why this happens. A concussion is an impact or an injury to the brain that changes how the brain functions. If we look at the idea that your perception of reality, everything you think, all of your emotions, the way you feel things, the way you move, it's all related to how your brain functions. If the brain is injured in any particular area, one or more of these things can be impacted. We could have a problem with how they are expressed or perceived. So we need to look at every concussion is unique. Every concussion needs to be assessed and treated as unique because of these variety of different things that can show up. So let's jump in real quick and talk about what symptoms tend to happen or which ones we're looking for immediately after an injury. If we look at an example of a high school football star and they're running down the field and they just get steamrolled by a defenseman, well, first thing we want to do is make sure we know, is that person conscious or unconscious? If somebody's been knocked out after a head injury, there's a pretty good chance that they've sustained an injury to the brain that is going to lead to a concussion. We also want to look and see, is that person oriented? Are they confused? Do they know where they are, what day it is, that they're playing football, that they're in their hometown? Losing your awareness of where you are or your memory of the incident is a really good indicator, again, of a brain injury. We also want to look and see if that person is dizzy, nauseous, if they're vomiting on the field. Maybe even they're uncoordinated and unbalanced. They're not able to move around smoothly. These individuals need to be taken off the field immediately and assessed by a professional, because there's a very good chance that they've had a concussion. The next thing we want to talk about is what happens in the days, weeks, or months following a concussion. Can your symptoms change? Can you have new symptoms? Maybe they get better or worse. And the answer is yes. These are all completely possible. In this situation, I like to make sure that when I'm educating people about concussion, I like to make sure we talk about the idea that the brain is capable of creating compensations or workarounds for these injuries to make it so that you do not experience these symptoms anymore. Now, realistically, you may hey, my headache is feeling better. But if that injury is still there and you're just working around it, then we may have issues with future concussions, or we may not be able to get that full recovery that we're looking for. So make sure to get these checked out. But let's look at some of the other symptoms that might show up. We know that headaches, brain fog, the inability to process information or remember information, the inability to keep attention on a certain topic or on a certain lecture or project can be an issue. We may have nausea and vomiting or dizziness, motion sickness in cars, maybe uncoordinated where you're trying to reach for something and you just can't quite get right to the target. We may have all sorts of other things happening with digestion or maybe fatigue of the eyes, especially with fluorescent lights or bright lights outside. Computer screens and cell phone screens can be a big problem after somebody's had a concussion because the brain just can't handle that level of stimulation. Now, the worst ones from my standpoint are the emotional changes that can happen related to concussion. And I've dealt with these personally in my own concussions. So the anxiety and the depression, the distancing in social situations and the wanting to draw back from your social circle and your family, the lack of emotional expression can be big, and they can change how you adapt and how you heal emotionally after these injuries. Now, the biggest one for me, the one that I want to spread more awareness about, is suicidal ideology. This is something that I suffered from personally, and I've known other patients who have dealt with it as well. Sometimes there's that voice in your head that tells you that maybe life would just be better or easier if you weren't around anymore. And that's completely not true. I encourage you, if you've had any of these symptoms, or if you know somebody that has had these symptoms after an accident, after an injury, regardless of what it is, please get it checked out. Find a professional who's been trained in concussion and who can help to assess where those problems are and really work to treat it and get it back to normal. Get it done. It's really, really going to make a big difference in that person's life or in your life. So these situations moving forward, how do they impact your life? And I've mentioned a couple of things already about, processing and memory and different things. If you're working and you're making mistakes all the time, or if you can't stay focused on a task, well, that's going to impact your ability to work. If you're in school and you can't study and you can't retain the information from your lessons and you can't perform on your exams, you're going to fail your classes. If you're withdrawing socially as a student and the majority of your social interactions during that school life, then you might lose out on a lot of that social interaction. You might feel isolated, and that pushes you further down that emotional rabbit hole. In adult life, feeling isolated, especially with that suicidal ideology, could be a very severe thing. We see a lot of this with veterans and PTSD related to concussions and impacts. It's very, very important. And these emotional changes, these perception changes, these coordination issues, they will impact your ability to perform in your sport if you're an athlete, in your life in general, and there is hope for these things. So again, I encourage you, please get these things checked out. If you have any questions, you can reach out to our office, you can email us, you can call us. We'll put the contact information down below. But I look forward to sharing as much information as I can in the future. I thank you for joining us for this time. I hope you have a grateful day.